Hi, everyone. Welcome to one of our famous Sunday night little segments, shall we call it? Something fun like that. It's good to be here with everybody and wanted to go over just a few things with all of you, kind of a quick overview, shall we say, and a few things first about NOCD. If you're looking for help for OCD or related conditions, check us out at nocd.com. That's NOCD.com. We help people with OCD and related conditions like body focused repetitive behaviors. So that might be skin picking or excoriation, hair pulling, or trichotillomania. We work with tics, we work with hoarding, and all of our therapists go through training for things like concerns around mood or also other anxiety disorders. So if you're looking for help in any of those areas, again, go to nocd.com. So I wanted to talk today to everybody about some various things. The misdiagnosis that OCD may go through, the misunderstandings, and sometimes even the lack of treatment that people are provided for OCD. I was speaking to someone yesterday who described going through 7 years of treatment for generalized anxiety disorder before finally finding out that it was actually obsessive compulsive disorder. And once they got the proper treatment and were doing exposure and response prevention therapy for their OCD, how much their life changed. So much so that they switched their career and now they're working in the field of OCD themselves, which was so exciting to hear and so inspiring because it really proves a point that I have been talking about for many years. When we give people the right treatment, they can get better. But if people aren't diagnosed with OCD, don't know they have OCD, or aren't getting the right treatment for OCD, the likelihood is they're going to stay stuck. And the last thing that I want to see is for anybody to be stuck. So there's a couple of things that are really important. Number one, good diagnosis. And that's definitely one of the things that we will do at NOCD. We will provide a diagnostic interview for everybody who comes through NOCD. And we'll do it over the course of 2 sessions. Why? Well, there's a couple of things. First, you got to do that paperwork stuff, right? The informed consents and things like that. These are required anywhere you would ever go for therapy. It's no different for us than anybody else. Number two, we really want to spend time building rapport with you. We want to get to know you, and we want you to get to know us. You've got to trust us. If you're going to share some of your most intimate or taboo types of thoughts with us, you better trust the person that you're talking to. Number three, we're going to get at least one diagnosis in that first interview. Why? Well, we want to set the stage for what we're going to be working on. That will also trigger some of the assessments that we will be using over the course of the work that we do. And we're really excited to use those because not only are we going to rely on our own clinical judgment about what it is that we're going to be treating, we have a structured interview that we use, and that helps us to confirm what those diagnoses are. And then we have the members that we're working with fill out assessments, and that also gives us information about the impact of those diagnoses on their lives. So that is really, really important. And we want to make sure that we get all of that information. The first question is going to ask about obsessions, and we're trying to go beyond the typical obsessions that people think about OCD. It's not just about what if I have germs. And then we ask about compulsions. And the questions we have about compulsions go beyond the typical washing your hands or checking the locks. We also look at taboo themes around sex and religion. These are things that OCD often will go to and utilize as reasons to get you to do compulsions, right? So we want to make sure that you're not just kind of seeing the run of the mill things that you might have an idea that OCD is, but it really does go into multiple areas. So all those obsessions, all those areas again around anything beyond germs, because it does go to sex, it does go to sexual orientation, it does go to pedophilia, it also goes to existential issues, real life events, morality, religion, all of those areas. Okay. When you have somebody who's got thoughts or images or urges around those, what do? They may do compulsions. And you want to know what those compulsions are. Well, they're not just washing your hands and they're not just checking the locks. They go beyond that. There may be mental compulsions. There may be prayers being said over and over again. There may be people who are driving around the block to see if they've run somebody over and it wasn't just a pothole. There may be people who are online incessantly researching things, trying to get the right answers. There might be people even going to their church, or their synagogue, or to their mosque or wherever they may go to pray, so that they can ask any of the holy people there to give them answers. And of course, none of those answers will be satisfying. So they're stuck in doing these compulsions, these ritualistic types of behaviors. And you're seeing that these are taking up a significant amount of their day, right? This is not just something that happens for a few minutes a day and then they move on. These are things that are repeated over and over and over again until they feel just right. Unfortunately, it never does feel just right. It almost always feels just wrong instead of just right. And well, we want to help people move beyond that. We want people to learn that they can handle the things that aren't feeling just right. Just because it feels not right doesn't mean that it is not right. But in OCD, we often use, if it feels it, it must be true, right? I will often point out to the people that I'm working with that every phrase that you've said to me today started with, but it feels like, or what if, right? These are the kinds of things that are cues to me that OCD may be going on. Now, when we get people the right diagnosis and we get them the right treatment, they start to live the lives that they want to live and not the life that OCD wants them to live. So what does that treatment look like? Well, it's exposure and response prevention therapy. It's two things. Number one, we're purposely exposing people to things that are uncomfortable. Those are the thoughts and the images and the urges, right? I don't need to expose you to anything that isn't already in your thoughts, images, or urges. I'm not going to create any kind of new fear for anybody whatsoever. I'm going to teach people that they can handle whatever it is that pops in their head. And the response prevention is the key component of all that, right? I already know what people are going to be exposed to because they're going to describe to me what the themes of their obsessions are and what all their compulsions are. So I need to know that. But what I really, really need to focus on is the response prevention. And the response prevention is the elimination of the compulsion, doing the opposite of whatever that is, and allowing for doubt and insecurity to be there. So if somebody's going to go and check the locks, well, what do we know? Every time you go and check the lock, it may feel better in the moment, but research has shown that the more that you check these things, the less confidence you actually have in it. So now you're checking it more and it feels good in the moment when you do it, but you're actually decreasing the confidence that you have in this experience. So now the likelihood is you're going to keep going back and going back and going back again. Well, I want to expose you to the discomfort that you have about, is the lock open or not? How can you be truly sure? And then not go and check it and allow yourself to just be able to think something along the lines of, it may or may not be fully locked. I'm going to have to live with that insecurity, with that doubt. I'm going to have to live with whatever the consequences of that may be. Now, you may say, boy, that sounds really, really tough. Why would we do something like that? And I always say this: if you were visiting a niece or a nephew who were in a detox unit, and they were begging you to sneak alcohol into the detox unit because they were so amazingly uncomfortable due to the fact that they were going through withdrawal, would you go get them alcohol? Now, my hope is the answer is no, that you would not go get them alcohol. Okay. So why is it okay to have somebody be physically uncomfortable now, detox, in order to be better later? But it wouldn't be okay for somebody to be emotionally uncomfortable now, obsessions, in order to be better later, not doing compulsions, right? And that's really what I'm asking people to do. If people do compulsions, they learn that the way to be okay is to do compulsions. And therefore, the strengthening of the experience is compulsions get deeper and deeper and stronger and stronger. And the last thing that we want to see happen is for compulsions to get deeper and stronger. We want to see them go away. And we want to allow people to learn that they can handle it. I'll ask all of you a very simple question. Does any of you have a guarantee that tomorrow morning you will be alive? You will wake up? Or will you wake up dead, as my grandfather used to say? I don't have a guarantee that I will be alive tomorrow morning. Now, that doesn't mean that I need to go to the doctor's office and get a stress test and a cardiac check, and I need to have a scope done, and I need an MRI and a PET scan and an echocardiogram and all these kinds of things, because even if I did all of those tests, it still would not give me an absolutely 100% ironclad guarantee that I will be up and awake tomorrow morning. So I'm going to live with that doubt, and I'm going to live with that insecurity. And I bet you're going to live with that too. That's all I ask for the patients that I work with. Any of the members that I'm working with, I want them to know that they can handle not having an absolute answer on something, that they can live in the doubt and they can live in the insecurity. We do this in a hierarchy. We build it up from low level to high level things. I'm not going to throw you in the deep end of the pool. We're going to stick a toe in the water and see how it feels. We do this because we know that OCD brings suffering and shame and guilt and disgust and anxiety and distress to people's lives. And people do compulsions out of shame, out of guilt, out of disgust, out of anxiety, out of distress, whatever untoward emotion, unwanted emotion you may have. OCD will use that against you as a way to get you to do a compulsion. OCD has one goal. You do compulsions. OCD eats compulsions for breakfast, lunch, and dinner. That's what it does, right? So if you want to grow OCD, do more compulsions. If you want to fade OCD, do less compulsions. I have seen people who have spent over 70 years of their life doing compulsions, hoping that today will be the day I do it just right, and then that will finally satisfy the OCD. It doesn't happen. No one in the history of OCD, as far as we're aware, has ever done enough compulsions for OCD to go, hey, that was it. Great job. Nice work. You solved it. You figured it out. I'm out of here. Talk to you later. That isn't the way that it works. There will always be more. And even if you achieve something that OCD wants, the next reply from OCD will be, okay, round 2. And now here's the next things that you're going to have to do. It isn't about satisfying OCD because OCD is unsatisfiable. It is about learning that you can live whatever the doubt or that uncertainty is in your brain that OCD is telling you is not acceptable. Remember, we still don't know if we'll be alive tomorrow morning or we'll wake up dead, as my grandfather always said. Now, I don't want to see people shamed into doing more and more of these behaviors, right? I mean, I have seen people who have done damage to themselves, even by the rituals or compulsions they do. They wipe their bodies down with bleach as a way to try to make sure there's not a germ on them. They call the police on themselves because they think they might have done something, even in the face of absolutely no evidence for it whatsoever. But that what if question is standing out there, and OCD hates the what if question and wants the answer. And it can lead people to do those types of things. We don't want to see this happening to the lives of people anymore. And that's why we're really excited to partner with you so that we can work together and make sure, again, that people live the lives that they want to live and not the lives that OCD want them to live. I hope you've enjoyed this video, and please don't sit in suffering. Don't sit in frustration. Allow yourself the grace that you would give to anybody else. In fact, maybe even follow the advice you would give to the people you love, which would be seek help. There's people out here willing to work with you. You may be one of those people who thinks, therapy's not right for me. Why would I ever talk to anybody else? And so I'm going to ask you a question. If you're a sports fan, think of your favorite player. If you're a musician, think of a favorite musician idol that you have. Why do people have coaches? Why do people have teachers? If you're being paid millions and millions of dollars to play a game every week, and you're at the top of your game, you shouldn't need a coach, right? Or is it nice to have a coach to offer another perspective and to show you another way to look at things? Because just maybe other perspective could shed some light on some stuff that you hadn't thought of, even if you're at the top of your game. Or if you're a musician, I mean, I'm a huge fan of the band Rush. Many people know that. Neil Peart, the drummer, was considered one of the best drummers ever in the history of the world. He even went to drum lessons about 20 years into Rush's career and went back to the basics and relearned drumming again in a different way, just because he felt like he could do more. But he didn't know how to do more on his own because he had his way of doing it, and he had someone else teach him a different way of doing it. You may not hear the difference in the drumming, but he felt the difference in the drumming, right? So no one has to be alone in this. No one has to suffer in silence. And I encourage you to reach out, because we have expertly trained people here at NOCD who are waiting to help you and want you to live the life that you want to live and not the life that OCD wants you to live. So go to nocd.com. That's NOCD.com, and talk to our team, and let's see what we can do for you. Thanks for watching.